grazing lands and those various things. We need to have balance on our state land board. Right now, the 3 members of the state land board are all Democrats, and they all live in Portland. You know, where's the balance there? Where's the voice for rural Oregon? Where's the voice for this guy down in Klamath Falls? We need to get some balance. We need to get some pragmatic thought on that board, and Newt Bueller will bring that.
Well, I spent the last few minutes trying to make who owns the water a bully issue, and I can't quite do it. What I can do is tell you that electing a statewide office holder like Senator Bruce Starr, who has values of less regulation and can advocate on behalf of Dr. Newt Bueller, who will be your next Secretary of State, and have that plan board, electing statewide leaders who have less bureaucracy as a standard, as a viewpoint. He can just advocate. It's not a bully issue, but he is a statewide leader. He's one of only 5. He will be one of only 5. So the advocacy that comes with that for less regulation would be huge.
Who owns the rain? Well, under Agenda 21, if we're not careful, the UN is going to own the rain. We've got to fight that. Somebody once said that if the government were in charge of the Sahara Desert, it would soon run out of sand. And when we were going here in Oregon, one of the rainiest states in the country, if we continue this path that the state owns all the raindrops, we'll soon run out of water. Gary Harrington was sentenced to 30 days in jail and a fine of I'm not sure how many $1,000 for the crime of putting digging 3 ponds on his property to capture the rainwater. And this is after he tried repeatedly to get the state to license him to follow the rules to have a pond. I mean, the guy wanted to follow the rules, they wouldn't let him. And then when they refused to let him, he did it anyway, and they jailed him and fined him. How dare you? My theory is we need to have trained beavers who will make ponds for us. And when the Portlanders come down and say, how did that beaver learn to operate heavy equipment? Oregon beavers were smart.
Go Beavs!
There is a case to be made for civil disobedience sometimes. Colorado had the same law, by the way, and in 2009 they changed it to allow people to capture runoff. So this is eminently solvable through legislation. And of course, as state treasurer, I'll be on the state land board, and I can bring pressure to bear to change state policy from there. That's the best I can do for you on this one.
I was okay when we started talking about beavers. I'm a duck. Craig loves it though. I know. You gotta have some place for the ducks to kind of swim around. Okay, the next, Alan, I think you're up next, aren't you? Yes. You want to come up here? We want everybody to know who you are. Huh? Alan Minton, huh?
Well, when I got here, I was handed a sheet of paper from someone who couldn't be here, and there were several questions on it, but I have a different question. I couldn't read all the writing, to be honest. CCOs are now a thing that's going to be happening in Oregon, and for anyone who doesn't know, that's Coordinated Care Organizations. Some people call it Obamacare, some people call it Kids Care, but it's here, and it's being implemented. And the government, federal government, has given the state of Oregon as a trial state $1.9 billion, starting out with $600 million this year. One of the things that this is going to do, and one of the ways it's going to impact every parent in this room, or every grandparent in this room, is that one of the things that happens when your child turns 15 is that the state becomes the parent of that child, and the state will keep from the parents the activities of that child if that child takes birth control, takes the morning after pill, or wants to be sterilized. I would like to know how each of you feels about that and what we can do about it. Thanks.
Alan, I thought you were going to ask a question that I could answer. Is that? Well, I can't answer that question because the potential legislation, and that's appropriate for me to tell you what I think about it. But you said something I do want to talk about. I want to just take a minute because I think it's important. You talked about kids. One of the things that people may not realize is that one of the most important, in fact, the most important thing that I do as a circuit court judge has to do with kids. And it has to do with juvenile law. It's the one thing that has really that I've become passionate about since taking the bench. And juvenile law has two components to this. It has delinquency. Kid under 18 commits a crime, we deal with that. But it also has dependency. This goes to your issue about how do we take care of our kids and make sure that as parents we're able to keep them safe and to help make decisions for them. There are a lot of people in this community, for whether it's drugs or whatever reason, aren't exhibiting adequate parenting skills, and their kids get taken in by DHS. And it requires the court to step in, and in that role, the child becomes a ward of the court, and I become responsible for them. So I end up having to deal with those issues. And what we know from the research is that every time that child is removed, every time that child is separated from a caregiver and that bond is broken, or they don't have the ability to make those attachments, that those kids are damaged. And a lot of times it's taking them from a bad situation and putting them in a good situation, but the mere act of removing them still creates damage. And so one of the things as a judge that I do, Alan, is I have to look at that and become an inquiring magistrate who makes sure that we're asking the hard questions of the Department of Human Services to make sure that we're only taking kids away when the danger of leaving them where they're at outweighs the damage of moving them. And then making sure that every level of government, of service, everything that we can is used to bring to bear to get that child, if possible, safely back with a parent, and if not, to do it quickly. So I know I'm stretching that question about as far as I can, but I wanted to make sure that people understand that I don't get to decide things about CCOs and about Obamacare or kids auto care or any other kind of thing. That's, I think, a question appropriate for the policymakers. But you mentioned kids, and that is one thing that I'm passionate about, and frankly look forward to over the next 6 years, making a real difference in our juvenile system so that our kids get the best shape they can to have a good future going forward.
What happens is that when your child is 15 and they're in school and they go to the nurse, and it's going to be a much different situation than it is now. That's a trial and that's important. Anything that is discussed in that school and nurse through the government program, the state program, it's kept from the parents. The parents do not, under any circumstances, have access to know whether their 15-year-old child has been sterilized, had an abortion, or anything else. It's taking the rights away from the parent and giving it to the state. And I want to know how you feel about that.
Well, I'm a father of a 15-year-old daughter, so I have some very strong personal feelings about it. It is inappropriate for me to tell you on a piece of legislation pending whether it's good or it's bad. And I say that not to be in any way disrespectful to your question, because it's a fair question. But one of the things that I did when I took on the robe and I took this office was I said, I'm going to limit my ability to engage in that kind of political activity. And so I got to stay true to that oath. So that's the reason I'm ducking the question.
We got a lot of social problems. When I wrote this, on the front it says, if elected, I will. And I want you to pay attention on these 7 bullet points for the first one or 2 words. It said, fight for, bring back, focus on, work to, protect, improve, and defend. So what we have here is we have a combination of problems. We're not graduating, we're graduating 2 out of 3. So now we have somebody who can graduate from high school, can't be a policeman, can't go in the military, can't be a fireman. So we have people that are limited in what they can do to get a job. We've had government that environmentalists who have taken away our timber, so we've lost over 40,000 jobs. We have a lot of people today that just don't have any hope. When we don't have any hope, how do you raise a family? How do you raise a family when you have, and then government has to step in because they want to save the kid, right? They want to save the child, and we all want to save the child. We don't want to see more kids get murdered or kidnapped or abused or any of that stuff. So these are some serious problems that we brought on ourselves. We have brought on ourselves. Because we haven't been paying attention. I haven't been paying attention. I probably should have been running for office 20, 25 years ago. But I'm here now. Better late than never, right? I'm raising my sons the correct way. They go to church, they're in Boy Scouts, they're doing that kind of stuff. But I see other kids that are not so fortunate to have 2 parents. So then, what's the state supposed to do? Let these kids, fend for themselves or what? Where's the rescue point at? Well, I think we just have to really look about who we're electing, what we're doing. We need to fix a lot of problems. We need to get people working, bring back some self-reliance, bring back a little bit of pride in yourself. Moms and dads, that's how I was raised. Don't throw a, I can see helping somebody but not giving them a headache. I mean, these are really strong social issues, and so I really can't blame the government for doing what they're doing, but then again, I can blame the government for doing what they're doing. Because we're in between a rock and a hard spot here. We need to get people, get their self-worth back. We need to graduate all the kids. We need to start bringing manufacturing back. That's why China's taking all the manufacturing. That's why people are going overseas to manufacture, because they can't get a permit to build anything in this place anymore. And it's really sad to see a state like this, with all the natural resources that we have, that can't even provide jobs for their own people. Can't take care of our senior citizens. Can't take care of our children. We can't do anything. That's why this election is the most important election in your lifetime. Ronald Reagan said, we're only 1 generation away from losing our freedom. And my sons are 14 and 16. If we don't win this election, my sons is a generation that will lose their freedom. So let's vote for the right people and get this thing turned around and collectively and collaboratively work together and solve these problems. Because I really don't have an answer for what's going on here. I know how to fix it now.
Alan, I appreciate the question about CCOs. I think there's 2 issues there. One is the right for me, the mother and the father, or whoever the family unit is to raise the children without having to have permission from the school nurse or the state or a judge. Debbie and I, between the 2 of us, raised 7 children, oldest in the 35 range, the youngest in the 28 range, and now have expecting our 10th grandchild. Parenting is not something that belongs to anybody other than the family unit. And so I would tell you that I would strongly oppose anything that interferes between a parent and a child. When I tell them to go to the room, don't want a judge or a state to have to say that's okay, do it, and tell you. And we raised our children to be healthy, contributing, very loved, and very happy adults who are raising families and children of their own. So now at stake is grandkids and great-grandkids. And what we're talking about is a fundamental shift in America, and it's happening at the state and the county level in terms of the transformation in healthcare. And to your point about CCOs, it's state law. They're required to form CCOs to try to cap medical expenses. And Marion and Polk County have entered into an agreement that others can share more details about. I would tell you that I would have proceeded much more cautiously. I think there are unintended consequences with the legislation. Not sure how it's going to get paid for. It's one thing, and this is typical state, put it out there, make it sure everybody sounds, it sounds like it will attain some objectives, and then later on, somebody writes the administrative rules, and then you start to find things that you didn't want in there. Do we need to transform healthcare? We definitely do. One of the largest costs facing next year's county budget, next to PERS, will be health insurance costs for the employees that are borne by the county. So I will tell you, both at the county level and then really at the person level, healthcare is out of control, needs transformation, needs something. But putting everybody under one plan, and it really is Obamacare. It was in anticipation of the Obamacare not coming through. The CCOs are attempting to do that, but I will tell you, I think there should have been a whole lot more deliberation and more aggressive action at the county level to say, stop, wait a minute, and let us be involved in the legislation. So I believe that the CCOs right now have the right intent of how we're going to pay for it, how it's going to work, and really, I think it gets right back to the fact that people need health care, but it's just another step towards socialism. And so I really believe that CCOs, while they're now in state law, the county should be aggressively trying to work with our good elected officials to make sure that unintended consequences, such as loss of parental control and authority, breaking up that family unit, as Judge Hill said, is paramount. A lot of the problems that Fred talks about in the country and locally, they all stem from the breakup of the family. And so I would never support anything. In fact, I will fight anything that disturbs the relationship between parents and their kids, because that's the way God meant it to be. So that's the way it should stay.
The good parents are in this room, and we have to support them, period. And we can't undermine them with state law or anything that says you can go behind parents, around parents, and through parents to their children without their knowledge and understanding. That's pretty fundamental, and I think we all agree on that. What federal bells and whistles in Obamacare are coming our way with regard to this, I don't know exactly. But as a result of that internet thing on organ sterilization, I went back and read our laws on sterilization, and they're pretty clear. You can't just sterilize a 15-year-old or a 16-year-old in this state. You have to go through a huge number of steps, including a judge's order. And the legislature even has some language in our law about the legislature, and this is unusual in our life, the legislature considers sterilization to be a very serious matter. And it made me feel better because I thought, well, at least the legislature in our statute agrees with me. It's a very serious matter. And I will be vigilant in making sure that we don't get into a situation where parents are undermined and willy-nilly on these kinds of issues. The CCO issue. When it was described to me the first time, this new Medicaid, this is under our Medicaid population. This is a specific population that's impacted by this change in Oregon's healthcare delivery system. I said, well, that makes sense. You pool these things. And they said, and it's going to save money. I said, well, I'm for that. Better model saves money. A few months later, they came back, oh, that money thing didn't work out quite that way. They said, wait a minute. I wasn't born yesterday. What was that money thing? Oh, well, this is a better model, never mind the money. Well, I didn't buy it, I voted against it. Okay? Because it isn't just about the model, It's about how are we going to get a handle and control these costs and still deliver top-notch health care. And what I see is a runaway train of costs and no guarantee that it's really very long. But it is now the law, it passed, and so I'm on board to be vigilant in trying to figure out how to make it work intelligently and keep those costs under control. I can't go back and take it away. I don't think the voters are going to go back and take it away. So now it's incumbent on me and all of you to keep an eye on these cost issues, the delivery model, and make sure that it isn't one, a runaway government in your business, and two, that costs really are controlled under this system. That's what I'll be working on. Thanks for the question.
This is an issue that I deal with a lot. I'm co-chair of the House Healthcare Committee, and vice co-chair of the House Human Services Committee, so these things are front and center. Up front to your question, I don't support anything that goes between the relationship of a parent and a child as an authority relationship. That said, with the exception of child abuse or some of those kind of issues that come up relative to families. But that said, I think we also have to recognize that we have a lot of children in this state, and I consider teenagers just only children, who are sexually active and they don't have a family. They either don't have a functional family or they don't have a family at all. They're living in the street. We have people in our county that fit that particular distinction. We need to do something about guardianship for unattended minors that strengthens a protective relationship for them. Now, I still don't think it's up to the schools to force birth control as an issue. The school can't even get it legally, we can't ask for it. So we're way off in the weeds when we start talking about birth control intrusion. But we do have a population of students who need help. They are sexually active. If we don't provide them with guidance and some kind of guardianship authority, they're going to get in a lot of trouble, and they're going to be make work projects with Judge Hill. I'm not sure he's already seen them. Anyway, so it's a complicated matter. But speaking to the CCO problem, and I consider it a problem, we inherited that from the federal government. It is now federal law that we're going down the pathway of Obamacare. The Supreme Court has examined it and said it's legal. And that's the supreme test of whether or not something can happen in this country. So the whole thing gets dumped down now on the states. I'm very, very cautious in the proceeding with this. Craig Polk is right in the middle of this with Marion Polk County. I've done the math a number of different directions. It doesn't pencil out. We don't have the money to pay for what we're agreeing to do. And let me give you two concrete examples. Under Obamacare, we have agreed to throw alcoholism and drug abuse into the middle of primary care and pay for it. Not only did we agree to do that, we also agreed to be measurable on the outcomes on which the federal government will reimburse us or fund this health care program. So we can't just take up drug abuse and say it didn't work, because we get slapped on reimbursement for that. So it's a perfect storm setup for the local level communities to be responsible for a whole lot of stuff we haven't been successful doing and jeopardize funding for more in the middle health care in the process of doing that. I don't know how we can even staff the program that we've launched. And I differ very greatly with the governor on this. He wants to expand it. He's got plans in the works to add state workers into that and to add teachers into that. So it won't be just Medicaid. It's going to be the first enormous step toward universal health care. And that's, of course, where that group wants to go. So all I can tell you at this point, be extremely vigilant. It's a problem, and I hate to say it, it sounds like I'm not a team player, but the best thing that might happen is for it to blow up early and get back to something that might work. Everybody agrees we have to reform health care because we can't control the spiraling costs, and it is not sustainable. But this isn't the way to do it. I think in the upfront, you're going to see the biggest rationing program ever perpetrated on the public come down this pipe as the only way we can address the size of the problem with the limited funds. And I also remind you, the federal government is funding this for the first round. The federal government is borrowing 40 cents on every dollar for their coffers. So 40% of the Medicaid money flowing to Oregon from the federal government was borrowed from foreign countries, i.e. put on a credit card. Is that the way you want to do healthcare? Is that going to be successful? It's just, we're completely out of control. We've let ideology get way ahead of practicality, and unfortunately, it's the law. And, we are the leader in Oregon of all states in implementing Obamacare. And I learned a long time ago that that can be a dangerous position in the end, because the guy up front in battle oftentimes gets shot first. So we're doing this to ourselves in part.
Tina, I don't want you to think I'm, after your husband or anything, but I got to say something about Judge Hill here. I mean, I've done this once today. My husband's over it for the first time, but he knows where I stand. One thing that the county has right now is a judge. That's not just lip service that he was giving right there. He really seriously cares about the youth in our county, and we should be very, very happy and proud that we have him. We need to make sure we keep him right where he's at. Alan, I think the key to your question is, it's here. It's here. So we can sit our hands, pretend it's not here, I'm doing it fast enough, and just right over top of us. Or we can get involved and seat at the table and make sure that we are in control. We know what's going on. And that's what we've done. We participated in developing one of the first CCOs in partnership with Marion County and a number of healthcare providers. And the key there is that we are in the driver's seat. If we don't, they have control. And I don't think any of us here want to give them control of that. And I'll tell you what, if anybody wants to come after my 15-year-old granddaughter, they're going to have to go over top of me to get there. So, what we need to do is pray. We need to pray for our kids. We need to pray for our leaders. We need to be thankful that we have the people that we do fighting for us in the legislature. But we need to be realistic. It's here, and we need to pay attention to it. We need to address it, and we need to be driver's lights.
You're right, it's here. 2011 legislature passed two very large bills. The Healthcare Transformation Project, or the Healthcare Transformation Bill, and the Health Insurance Exchange, excuse me. I was on a committee, I think I would remember that. It's all that range, exactly. Representatives, OHP takes up about, what, 25% of our budget? Something right like that. Maybe even more than 25% of our budget. It's a big deal. Healthcare is a big deal. Oregon Health Plan is our Medicaid. Who better to make sure that those bills meet the set benchmarks than to have a doctor as your state auditor? Dr. Bueller has worked in the medical field for the last 20 years. He's an orthopedic surgeon. He actually serves on the board of directors of the largest hospital system in Central Oregon. He actually is the chair of the committee that implemented auditing measures at that hospital that drastically cut costs and improved efficiency. So I ask, who better, again, as your state auditor, to be the one to make sure that we are meeting these benchmarks and we don't let the costs just run up. In addition to that, again, when you're talking about budgets, no margin, no mission. And any business owner can tell you that. If you don't have a margin above what you're putting out and what you're bringing in, you can't do much. And we need to have more jobs to enable us to have more taxes, a larger tax base. so we can provide our fundamental services. And then finally, to speak to Tom's point, one of the biggest threats that's facing our state right now is PERS. It's the $16 billion Category 5 hurricane off the coast of Oregon. And we have to do something about it. If we want to have good schools, if we want to have good health care, we have to address that issue. And Tom's put forth a plan. New Bueller has put forth a 6-point plan as well to reform PERS. And that's where we need to start. Thanks.
Again, we'll keep this one short. I'm not an elected official, nor does Boley have much to do with that situation, but I can say that I'm here on behalf of Senator Starr to speak to his character. I have a 15-year-old daughter and a 13-year-old son. As a kind of statewide elected official that can take that office and work with his what will be former colleagues in the House and Senate to best represent you all, his constituents, people of the state of Oregon.
I made extensive notes. The question was about this new law that allows a 15-year-old to give informed consent to their own sterilization. While I was listening to the answers, I actually downloaded the Oregon Health Authority consent form that says ages 15 to 20 sign here. It's in Oregon Revised Statutes 436.205 to 335. That's the law. When I lived in Tigard, Oregon, something vaguely similar happened. They wanted to pass an ordinance that said that you couldn't trim your own tree without a mother may I from the city. And I asked them, now, if you're taking